This was the PARTNER 3 mitral valve and valve trial, which is an industry-sponsored trial looking at what to do with patients with failed bioprosthetic valves in the mitral position. The study enrolled 50 patients in a multi-center fashion, and all the patients underwent a mitral valve and valve transcatheter case through the groin, so transfemoral transseptal puncture. Older patients in particular could benefit from the mitral valve and valve procedure. The average age of patients in this trial was 70 years old. You have to understand how we do this procedure, understand why this is beneficial for these patients. The operation is done guided by echocardiography and fluoroscopy. There's no chest incisions. The device is delivered through the groin into the veins, crosses the septum within the heart, and the valve is placed within the old surgical valve. Typically, recovery in the hospital is about 2 days, and recovery at home is about 2 weeks. This, on the other hand, is compared to open heart surgery, which has an estimated operative risk of over 5% and 6 weeks of recovery at home. This study showed a 30-day operative risk of 0% and risk of stroke at 30 days of also 0%. There was no deaths and strokes, in fact, out to 1 year. So these results are quite impressive and represents a step forward for patients with failing bioprosthetic valves who can now have an alternative to open heart surgery. But it does not tell us about the durability of this procedure. And that is why the procedure is being followed out to 10 years. So it still remains to be seen whether or not this is a procedure that's going to be durable for our patients in the long term. What some people don't know about this study that was published in the circulation Cardiovascular Interventions is that it's led to label expansion for mitral valve and valve procedure to patients not only who are at high risk for open heart surgery, but now also to patients who are at intermediate risk for open heart surgery. So this opens up another option for patients with failing bioprosthetic valves in the mitral position.